Dr. Leslie Rubin, who is accomplished in so many fields, I hardly know where to begin. But he is professor of pediatrics at the Morehouse School of Medicine and the Southeast Pediatric Environmental Health Specialty Unit at Emory University, the medical director of Developmental Pediatric Specialists in Atlanta, Georgia, and president of Innovative Solutions for Disadvantage and Disability. We'll hear more about that from Dr. Rubin later on this afternoon. So, Dr. Rubin.
Thank you, hello, everyone. Thank you, Lucy, for inviting me here. And nice to meet you all. My task is to look at the pediatric aspects, the factors that, that those of you who deal with children might have to face. Right, my disclaimers. The head of CDC said that never in the history has there been such a dramatic effect on the fetus from a mosquito. And I just thought I'd tell you what thoughts went through my head. Is we're dealing with the Zika virus. Zika virus comes from Africa, from the Zika forest in Uganda. But we've dealt with these African viruses before. With HIV is another one of those viruses come from Africa through primates, and so has Ebola. So we're going to have viruses come and go, and they're each going to pose different problems for us, different challenges. And as long as we can tackle them in the way we are, with incredible investment in labor at CDC, I can tell you, because I live in Atlanta, and all the CDC people I know are not doing what they were doing before. They're all like doing CDC stuff, and the people who are not doing CDC stuff are doing the stuff that the people who are doing, they're doing Zika stuff. The people who are not doing Zika stuff are doing the stuff that the people who were doing other things are doing for Zika. So, crazy. Anyway, Zika is not the only virus, or the first virus that we've become aware of that caused problems in the fetus. And I just wanted to alert you to, or remind you of, the fact that in the 1960s there was a massive epidemic of rubella. Now, rubella in kids produces a rash, but rubella in pregnant women results in major outcomes for the fetus. And in the mid-60s, there was a massive epidemic with about 20,000 women who were infected during their pregnancies, and these resulted in a condition which is called congenital rubella syndrome. The kids who were born with the most severe cases were called, and I hesitate to say this, but this was the term used, blueberry muffin baby, because they had these little spots that were petechiae on their bodies. And but the main problem was it affected the central nervous system, the brain. And I can tell you, because I took care of many of the kids in a later stage, and most of their problems were intellectual disabilities, seizure disorders, visual and hearing impairment, but also autism. So that's very ironic that, that autism was part of the clinical spectrum. But so the lessons we learned from that, and these are lessons that are being recapitulated in the Zika age, is that pregnant women who are infected with these, even if they have mild infections, can affect the fetus to a significant degree. And as was mentioned by Kristen before, the other viruses we're aware of that can cause similar effects on the fetus, such as toxoplasmosis, cytomegalovirus, herpes, HIV. And now the other lesson we learned is that we should give vaccines. And I put this in the entrance in a dramatic way, because the irony is that so many people are avoiding MMR vaccines because they say it causes autism, when the vaccines are preventing conditions that could potentially cause autism. So there you go. This is fascinating to me in that the Zika viruses live and reproduce in other cells. They're just pieces of DNA or RNA, and they have to get into cells in order to replicate. So when they do get into cells, they have a predilection for certain cells. Each virus has its own character, and these Zika virus seems to like neurons and gets in and just messes things up. So it messes up mitosis. And what happens then is not only messes up mitosis, if it hits the neural stem cells, and the neural stem cells we know produce neurons, astrocytes, oligodendrocytes. And what happens then is because the virus just destroys the reproductive capability of the cells, it sort of leads to apoptosis, and you don't get all these cells. And if you don't get all the cells, and you don't get all the differentiation of the cells, you're going to have many less cells in the brain. And that's what happens in the Zika infection. You get less cells, and you get less cells, you get a smaller brain, and then hence the micro, which is small, cephaly, which means head, so it's the small head. Now, the congenital Zika syndrome, like the congenital rubella syndrome, has certain characteristics, and it's defined by the fact that there is some history of infection in the mother, and at birth, the kids have certain characteristics, which is small head circumference and often eye pathology. And it's very interesting because one of the first findings or reported findings on congenital rubella was in fact cataracts and uveitis. So that's not unusual that these viruses that attack the central nervous system will affect the eye. But also, here's a picture, also because it affects the brain, it affects what the brain does. And what the brain does is controls function. Motor function, cognitive function, social function. And so these kids will have limited responses, abnormal muscle tone, limited limb movements, joint contractures. They will be neurologically involved. So what do we need to do in the initial newborn period? The most important thing, if you're evaluating the infants, is obviously to do the typical newborn neurological examination, and particularly look at the eye. And you might need an ophthalmologist to do that, and then do an auditory brainstem response. The standard newborn hearing screening is inadequate according to the CDC. And the thing about this eye problem is that these two is that it's so similar to congenital rubella, the eye and the hearing. So these are neurological impairments in the sensory system. The CDC also recommends that blood tests be taken, serological testing for Zika, and we heard about some of the kind of limitations on what that will reveal, but also blood count, metabolic panels. Did it affect the liver? Head ultrasound is helpful, and the MRI if necessary. So I don't know. I was trying to work out what the CDC was trying to get at with consider MRI, which is their language, and I wasn't quite sure, so I just leave it in there, consider MRI. In addition, when you see the newborn infant, you need to say, okay, what is going on here and what do we need to do? So what they say is that if the clinical features are uncomplicated, then you definitely need to refer for early intervention and for physical therapy if necessary. That's for the motor system. However, obviously, if there are any complications, and they list these in this document, which I recommend for any of you who want to look at what the comprehensive recommendations are of the CDC. It's a wonderful document. You can get it online, MMWR, from the CDC, August. And I'm sure there's newer reports, but this is their comprehensive document. Anyway, so you refer as necessary, and they comment on possible joint contractures because of the muscle spasticity, and they also comment on because you're having the fact of the virus affecting the brain and brain cells, you can have some hypothalamic pituitary dysfunction. Refer to an endocrinologist. And obviously, if there's a question of diagnosis, they recommend you consult with a geneticist or anybody in infectious disease to tell you whether this is the Zika effect or not, or Zika is involved. As far as breastfeeding is concerned, the statement is that the benefits of breastfeeding outweigh the risks of Zika, and both the CDC and WHO strongly recommend that you continue with breastfeeding regardless. So there you go, if there's any concern about breastfeeding. The nice thing about what the CDC has done as well is that they address the needs of parents, because you heard Dr. Samin, right, tell you about the anxiety of parents, and most of the counseling's to parents who are anxious. And I just cannot imagine for the parents to have an infant who has such a condition where you have this kind of long-term commitment to helping this child, and whatever the consequences might be, the uncertainty and the consequences. And this is, the CDC says this is particularly important for the low-resource families, the low-income families, because they're already overburdened. They already have a whole host of pressures and limitations to their resources. So they recommend that we use the local, state, regional resources, because they've been built into place from decades ago, from laws that were passed that include the early intervention programs. They also recommend that we tell the parents to look at the CDC website. There's a specific site for families who have newborn affected by Zika, so we can tell the families to have a look at that site. In California, you have a wonderful program called California Early Start, which will provide services to children with any children birth to 3 who have developmental delays, developmental disabilities, and that's the mainstay. And I will tell you, in Atlanta, when I deal a lot with the low-income minority families, whenever we have any difficulties, we go straight to our version of this California Early Start, which is called Babies Can't Wait in Georgia. And they provide in-home counseling, in-home therapies. And it's not intense necessarily, but it's something and it's helpful. So I strongly recommend you use that. And then, of course, for the long-term follow-up of the infants, there's some standard issues, some standard things you need to do, routine health care, monitor growth and development, test development at each visit, refer for therapies and specialty services as necessary, provide support for families, establish a medical home. This medical home concept is a very important one for kids with disabilities, and in fact the medical home concept was developed specifically for kids with disabilities because of the multiple services they needed and the need the families had for some degree of coordination of care. And that's the medical home concept. And ideally, an interdisciplinary team, if there is one. And I'm sure that this would be more relevant in areas where the Zika virus is much more prevalent. And so there's Texas and Florida so far. So, but stay tuned, and I think the more we're on top of it, and I think the very fact that there was such a mobilization of resources internationally has resulted in that sort of limitation in the spread of the virus. So the fact that we're talking about it, and you might say, well, I don't know if I'm ever going to see anyone with it, is good, because hopefully you won't. And in California, and hopefully we've contained it, and it will kind of begin to recede. The CDC also recommends additional evaluations for kids who have the diagnosis of congenital Zika, and that is that a comprehensive neurological exam at age 1 and 2 months, and then as needed after that. Definitely routine eye exams at 3 months, and also hearing again, assessment at 4 to 6 months. They also recommend thyroid screen, again, because of the hypothalamic pituitary effect that might take place in the more severe cases. Also, as mentioned, that there have been some fetal deaths, and obviously there's a great range of severity in the expression, depending on when the mother had the infection, which trimester, the degree to which she has a viremia. And so this is another statement made by the CDC based on a finding there where they reported in November that there were 13 infants born who had congenital Zika without microcephaly at birth, but who may have later problems. And if you bear in mind that with the congenital Zika, you've got the virus. If the infant has a virus, then the virus is still in the body, it's in the brain, and it's going to affect cells. So there will be some later consequences. So even if the infant is born with let's say, average size head, you do need to follow these infants according to the criteria of the CDC. Now, they don't know what the long-term outcome is because it's only been discovered in the last couple of years, but I think we can take our lessons again from the congenital rubella epidemic, where we had developmental delays, sensory disturbances, visual disturbances, clinical picture of cerebral palsy. Also, who knows, even the clinical picture of autism, as happened with congenital rubella, feeding problems with the more severe oral motor difficulties, and some behavior challenges. And these, we have no idea what they might be. And I think you also had something like this up in one of your slides, but I left it in anyway. It doesn't hurt to repeat some things that are important, and these are important things. Also, Zika is a notifiable condition, that if you do see a case of Zika, you do need to notify your local health district or whatever it is. It's public health department, and depending on, and regardless of whether the child has had any infection or not. So if there is any history of Zika or potential Zika, you do need to notify your health department. All right, so in summary, number one, you need to know about Zika, and you need to know about Zika in your community. And even if you don't need to know about it in your community and there isn't any Zika, you do need to know about it in the world, because just in case, you just need to be aware. Secondly, if you see an infant who has a small head and in your workup you're looking for any of the other causes, the genetic or the intrauterine infections, the torch infections, or, as mentioned, tobacco and alcohol also result in the small head circumference, you should just bear in mind Zika. Thirdly, you really need to have a very systematic approach to these infants, because you need to monitor their development. You need to try to encourage a more positive development with the therapies and interventions. And most significantly, from my standpoint, is the support of the families, because they have to deal with the realities as well as the anxieties. So there are realities and anxieties, and they have to deal with both. So it's important for us to have that in mind. So that's the support for the families, and then, of course, notify your public health department. So that's it. And, of course, we as Kirsten mentioned, we are still learning. We're learning all the time, and it's very helpful if you just keep up with what's going on, and it's at the CDC website. So I thank you for the opportunity to present.